Hi everyone, my name is Allison McNally and I will be summarizing chapters 8 and 9 in Everett M. Rogers' Diffusion of Innovations, 5th edition for Evidence-Based Practice 2. Chapter 8 covers diffusion networks and chapter 9 covers the role of the change agent. In order to understand how innovations diffuse through systems, organizations, and social groups, we must first explore how communication processes, networks, and the role of different individuals in the diffusion process, such as change agents, change agent aides, and opinion leaders, and how all those network together. Chapter 8 discusses opinion leadership and communication networks, as well as critical mass and its role in diffusion. Interpersonal networks and influences are instrumental in how ideas and change and innovation are adopted. Opinion leadership is the degree to which an individual can influence others' attitudes or behaviors in a desired way with relative frequency. Opinion leaders are individuals who lead in influencing others' opinions, and their behaviors are essential into shaping and influencing the rate of adoption of an innovation within a system. The diffusion curve is S-shaped because opinion leaders adopt an innovation, tell others about their experience with the innovation, and then the number of adopters per unit increases over time in an exponential curve. Interpersonal communication also drives the diffusion process by creating a critical mass of adopters. So there's two models of communication flow, which you can delve into further on your own, but I'll briefly discuss the two models in this video blog. One model is the hypodermic needle model. This postulated that mass media had a direct, immediate, and powerful effect on a mass audience. However, it ignored the role of opinion leaders. The two-step model suggested that ideas flowed from mass media, such as print and radio, to opinion leaders, which would be step 1, and from opinion leaders to less active sections of the population or their followers would be the flow of information, and that would be step 2. The first step is mainly transfer of information. The first step, which is step 1, is mainly the transfer of information from mass media to the opinion leaders. But then step 2 is the opinion leaders taking their experience and using their interpersonal influence within their communication networks to reach out to followers. Communication networks can be described as homophilous or heterophilous. Homophilous networks are those in which individuals who communicate are similar. They have similar attributes, similar beliefs, education, socioeconomic status. Heterophilous networks refer to those in which individuals who communicate are different from one another. They have different perspectives, different attitudes, different belief systems. So the way I think about this is homophilous is likely your core set of friends. You have similar beliefs, similar socioeconomic status, probably similar education, but then your heterophilous network would likely be at work or in your education setting where you're exposed to different perspectives and different belief attitudes. Homophilia occurs more frequently because of the ease and effectiveness of communication. When you're communicated with people who are like-minded, communication is easier. Versus heterophilia, you're communicating with individuals who are markedly different from you, and communication is more difficult and can often lead to mistaken interpretations or ineffective communication. Heterophilia, however, is essential in diffusion and innovation as it allows ideas, change, and innovation to be transferred from click to click through bridges or individuals who span a set of two socially dissimilar communication networks. While homophilia accelerates diffusion within a close-knit network because everyone has the same belief system. So if you have an idea or innovation, your group is more likely to adopt it. The diffusion process can only occur through links that are somewhat heterophilous, excuse me. So in order for that diffusion to reach critical mass or to reach a larger group of adopters, it has to cross a bridge. It has to cross somebody who spans two different cliques. If homophilia is a barrier to diffusion, so say the group is too much alike, change agents should work with several different opinion leaders within a system to increase the degree of heterophilia. In contrast, if there is a high degree of heterophilia, change agents to concentrate on a few opinion leaders to really get that innovation out. Opinion leadership and network links can be measured through 4 methods: the sociometric technique, informants, ratings, self-designating techniques, and observation. So opinion leadership is measured in these 4 ways, which is how, if you are a change agent, which we will discuss in Chapter 9, this is how you would identify people that are likely to get your innovation out to other adopters. So more information can be found on these types of measurements or measurement methods in Table 8.1 on page 309, but I'll briefly go over each one. So sociometric method asks respondents whom they sought out for advice on a given topic. So the sociometric method is me asking individuals one by one, like a poll or a survey, saying, who do you go to for advice? The opinion leaders are those identified with receiving the greatest number of sociometric choices. So me getting the most votes would mean that I'm the opinion leader. Similarly, informants ratings methods refers to a process of asking key informants to nominate individuals whom other people sought out for information or advice. This means I would poll, nursing administration and ask, hey, who do you think are your opinion leaders? Who do you think on your floor people go to get advice? So that's another way that you can identify opinion leaders, is using key informants. The self-designating method asks respondents to indicate the degree to which others in a system regard themselves as influential. So you sit down with a group of people and say, do you, on a scale of 0 to 10, how influential do you think you are? And they self-report and self-designate who the opinion leaders are. And lastly, in the observational method, an investigator identifies opinion leaders based on direct observation. So this works better in a smaller environment where you can actually watch interpersonal networks and the degree of homophilia and heterophilia amongst a system. Choice of a method to identify opinion leaders is based really on convenience, as all methods are equally valid. But when you're identifying and selecting opinion leaders, you have to think to yourself, is there an all-purpose opinion leader, or are there specific opinion leaders for each different issue? Polymorphism is what you would use to describe an individual who is an opinion leader, but could be an opinion leader on a variety of topics. Whereas monomorphism is the degree to which an individual acts as an opinion leader for a single specific topic. So how do opinion leaders differ from their followers or non-leaders? Opinion leaders are good with external communication exposure. They're accessible. Typically, they have a higher socioeconomic status, and they're innovative. They tend to be those individuals who have greater exposure to mass media. They're cosmopolite, and they have greater contact with change agents themselves. In terms of accessibility, they have greater social participation, extensive interpersonal networks in which to spread an innovation. They adopt new ideas and innovations way before their followers. However, if a social system is not ready for change or does not favor a particular change, these individuals are not especially innovative. You may ask yourself, do opinion leaders really matter in diffusion of innovations? The answer is yes. Table 8.2 provides 8 randomized controlled trials on the effects of opinion leadership. These trials reported that opinion leaders' interventions were effective in bringing about behavior changes in forms of different screening and prevention measures for heart disease, HIV, and breast cancer. Opinion leaders in these studies believed in and had firsthand experience with these disease processes, and they also experienced the benefit of what these interventions were targeting. Their personal experiences influenced other people, leading to widespread diffusion across multiple interpersonal networks. So no matter how opinion leaders are identified or trained, opinion leadership can have strong effects on healthcare and health promotion and disease prevention. When deciding whether or not to adopt an innovation, individuals depend mainly on communicated experience of others, much like themselves, so a homophilious network, and they depend on these people who've already adopted the idea, including opinion leaders. Innovations flow mainly from interpersonal networks as potential adapters look at their peers' experiences. There's strong evidence to support the importance of interpersonal networks on diffusion. So the example that I really liked from Rogers and Kincaid focused on the diffusion of several family planning innovations in 25 Korean villages. What they found is that although each Korean village had been a target of the same national family planning program with different forms of family planning methods, they found certain villages became pill villages, or certain villages were IUD villages or vasectomy villages. What they found is that each village's opinion leaders adopted a particular family planning method and then shared their experience with fellow villagers through their interpersonal networks. The result was a tendency for every adopter in that village to use the same family planning method regardless of whether it was appropriate for their situation or not. Interpersonal networks consist of interconnected individuals who are linked by pattern flows of information, and these networks have a degree of structure and stability. So in personal networks, you can have pretty much two different structures. One is interlocking and one is radial. Interlocking networks consist of a set of individuals, all of whom interact with one another. So I think of this as, my set of girlfriends. We're all interacting. We all text each other. We have group chat. Whereas a radial network consists of a set of individuals, kind of like on spokes of a wheel. You have a focal individual in the middle, and they communicate with each person individually. However, the people on the outside of the wheel do not communicate with one another. Radial networks are obviously more open as the focal individual can communicate and exchange information with a wider environment. And oftentimes individuals seek information outside of their interpersonal group. So another theory that has been postulated is the strength of weak ties. So a weak tie in a social group would be your ex-boyfriend, your mom's best friend, or your former coworker or former boss. They're not in your direct interpersonal network. They wouldn't be considered a strong tie. They would be considered a weak tie. So this theory explores why weak ties and interpersonal networks can be more important than strong network links. Weak ties often possess information that maybe a focal individual in a radial group or the group of individuals in an interlocking group might not already possess. Weak ties are often serve as those bridge links that we talked about earlier and connect two or more cliques. So even though weak ties are not a frequent path of communication in a radial group or an interlocking group, they play an essential role in diffusion of information and increase the heterophilia of a system. Sorry about that. The last concept of chapter 8 that we're going to discuss is critical mass. Critical mass is the point at which further diffusion becomes self-sustaining. It occurs at a point in which enough individuals in a system have adopted an innovation such that the innovation's further rate of adoption is self-sustaining. Once critical mass is reached, the rate of adoption accelerates to form that S-shaped diffusion curve. Critical mass bears on the relationship between behavior of individuals and a larger system in which they're a part of. Network externalities can also affect critical mass. So whether goods or services become more valuable or less valuable, the number of users can increase or decrease, leading to an everybody is doing it effect, which again can increase or decrease the rate of adoption. After critical mass is reached, norms of a social system typically encourage further adoption, creating that self-sustaining curve. Critical mass can also affect its continuation of innovation, as I just mentioned. Users can defect or discontinue use of an innovation, and when this happens, benefits to the remaining users decrease, costs increase, and further defection is stimulated. So critical mass typically involves use of opinion leaders as well, and communication networks. Those both contribute to the power of critical mass in the diffusion process. Just as systems and communities and organizations have critical mass, on a grander scale, individuals themselves have what we call thresholds. So a threshold is the number of individuals it would take for me to adopt the innovation. So the number of individuals, like I would need 5 people to adopt an innovation in my social network before I would consider adopting it myself. Threshold models assume that an individual decision to adopt an innovation depends on the number of individuals in the system who already have made that behavior change. The example provided in the book discussed a riot. So the number, how many individuals would it take for me to participate in a riot? So let's say my friend Bob has a threshold of 0. He's just a loose cannon. So Bob is the first one to throw the brick. Well, maybe I take about 5 people before I participate in a riot. And that's my threshold. Well, by Bob throwing that brick, that's not going to reach my threshold to participate. However, if the next 4 individuals also participate because maybe they have a lower threshold, all of a sudden I see 4 people and then that 5th one joins, then I will participate. As a threshold of adoption varies individual to individual, an early adopting individual may decide to adopt an innovation in anticipation of a perceived initial benefit. Innovators rush to adopt interventions because they have a very low threshold versus later adopters who have stronger resistance and require more information from opinion leaders in their interpersonal networks before they adopt an innovation. And again, an individual is more likely to adopt an innovation if more of their individuals in his or her personal network have adopted previously. By adopting early, innovators help later adopters reach their threshold. So innovators are on one end, they adopt, and by doing that, the laggards and the later adopters can look at them and say, okay, well, they're adopting, maybe they're more likely to believe in combination with their interpersonal networks and opinion leaders. Other strategies for reaching critical mass besides individual thresholds is obviously targeting highly respected individuals for initial adoption. So getting opinion leaders on board or targeting innovators to be champions for a cause. Another means is implying that adoption is inevitable. So by saying eventually everyone is going to have to accept this, you might persuade or decrease the threshold of individuals to adopt an innovation sooner than they normally would. Introduction of innovation to intact groups whose members are likely to be more innovative. So you pose the innovation to a group of innovators, they're more likely to take on the innovation and become opinion leaders. And then lastly, you can always provide incentives for early adoption. So that summarizes chapter 8. We're going to move on to chapter 9. Chapter 9 focuses on the role of the change agent. So we discussed opinion leaders and we discussed interpersonal networks and how all that can help diffuse an innovation. So now we're going to discuss the role of the change agent, relationships with clients, and various strategies for changing human behavior. So a change agent is different from an opinion leader in that a change agent is an individual who influences clients' innovation decisions in a direction that's deemed desirable by a change agency. So the way I think about this, and I will discuss this further at the end of my blog, is that your change agency may be your hospital. Your change agent may be your chief nursing officer or your CEO. And then they're going to just find and identify opinion leaders that people, look to for advice, or they're going to identify champions to help with the innovation. So I hope that kind of makes sense. I think of it as kind of a pyramid structure with the change agency at the top. The next is your change agent, followed by opinion leaders and followers in varying stages. The change agent usually seeks to secure the adoption of the innovation, or they may attempt to slow the diffusion process to prevent adoption of innovations if there's an undesirable effect. In an effort to customize, design, and deliver communication programs, change agents target characteristics of their intended audience to emphasize cultural sensitivity. Targeting is an umbrella term, but a very specific form of targeting is tailoring. This is when a communication is directed toward an individual who represents a very homogeneous audience. When targeting a specific individual or a population for innovation, change agents have 7 roles in the process of introducing the innovation to a client system. So their role evolves over time as the client system begins to adopt the innovation. So initially, their role is to help clients become aware of their need to alter their behavior. So they need to make clients aware that they need to develop a need for change. Next, the change agents develop a rapport because they have to be perceived as credible and competent and trustworthy. Otherwise, clients may not accept the innovation that the change agent will pose. So their goal is to establish an information exchange relationship. Next up, they have to diagnose problems. They need to analyze their clients' problems and understand why alternative solutions may not have worked for this client. Clients need to understand that existing alternatives might not meet their needs before they'd be willing to accept an innovation. Next, the change agent needs to motivate and promote interest in their innovation and create an intent to change within the client. They need to show them why that their innovation is going to make this change better, that it's going to make this change move. Next up, they translate intent to action. So they utilize their interpersonal network influences, their opinion leaders, opinion aides to promote the innovation within the client system. Next, the goal is to stabilize the innovation and prevent discontinuation. So the goal is to reinforce the behavior through positive messages and help stabilize the system once the innovation is in place. And lastly, the goal is to achieve a terminal relationship. So the change agent seeks to shift from the client from a position of reliance on the change agent to one of self-reliance. Change agents are successful due to a number of factors. However, their personal effort into the innovation, the client's orientation, the change agent's compatibility with the client's needs, as well as the change agent's empathy were identified as key factors in the change agent's success with diffusion. As previously discussed, change agents usually differ from their clients in many respects as well, not only from their opinion leaders, but as well as their clients. They typically have a higher socioeconomic status, greater social participation, formal education, and cosmopoliteness, similar to their opinion leaders. The more elite a client is, the more homophilous they are likely to be with a change agent. However, some clients of lower status, as a result, are heterophilous from a change agent, and they may distrust the innovation that the change agent is posing. This is where the use of change aides can be useful. So an aide is someone who is less than fully professional change agent. They intensively contact clients to influence innovation decisions. Aides are viewed as homophilious with lower status members, and selection of aides according to gender, formal education, and personal acquaintance can help minimize that gap between a change agent and their client system. So the way I think about this is, let's say your change agent is a physician. Your physician comes in, they explain a procedure, they explain a medication, they discuss a surgery with a patient. While the patient may feel that they are very heterophilous from that position, given the higher socioeconomic status, more formal education. So they look to someone else, or even gender actually. They may look to the nurse as a change aide. They may identify and say, well, he's a man and I'm a woman. He just doesn't understand. Maybe the nurse is a woman, and then, they can connect on that level. Or maybe they view the nurse as having a more I won't say less formal education, but maybe they view us as being more their peer and they can identify us more. Or maybe we have a personal acquaintance with them and, maybe we're a bridge to their clique. So change agents can utilize these change aids to work through opinion leaders. They can work through the client system to secure adoption of innovation by the client. By focusing communication activities on opinion leaders in a social system, a change agent can hasten the rate of diffusion. By enlisting opinion leaders, change agents provide local sponsorship and sanction for their new ideas that are introduced. Lastly, in Chapter 9, in recent decades, there have been alternatives to a classical diffusion model that exists in decentralized diffusion systems. So a classical diffusion model, which is kind of what we've been discussing, functions well in a centralized diffusion system where there is overall control of decisions and it flows from the top down. So again, it flows from a change agency down to the followers, from experts to users. In contrast, decentralized diffusion systems are client controlled. So things kind of bubble up instead of coming from a research and development setting where it's from a set of experts to users. Innovations kind of come up from local experimentation from non-expert users. So I want to pose 2 discussion questions for you based on chapters 8 and 9. Number 1, I want you to think about your healthcare organization or workplace. What was the last major change that occurred? Was it introduction of new technology? Was it restructuring of a department? Did you recently get designated by, a specialty organization? Did you have a JCO visit and you had to make changes? So identify your last major change and then ask yourself these questions. Who were your change agents? Who were your change aides, if there were any? Who were your opinion leaders and champions? Would you say your opinion leaders are monomorphic or polymorphic? So that's question number 1. And then discuss the difference between centralized and decentralized diffusion systems. So tell me what is centralized, what is decentralized, and then think about your type of healthcare organization or workplace. Do you view that as centralized or decentralized? How does an innovation get diffused in your diffusion system? And give me an example of how you think each diffusion system can work in the healthcare field. My example for that would be I think Mayo Clinic is centralized. I think typically everything comes from top down. However, sometimes I think on a unit level, so a system within a system, if you will, I think overall Mayo is centralized, but I think sometimes it is decentralized as well. So I think on a unit level, we're very much encouraged to do quality improvement projects and things like that. So to me, that would be something bubbling up from a decentralized diffusion network. And then these changes make their way to the top if they are good. So I think Mayo is overall centralized, but can also be decentralized as well. So to kind of discuss my answer for number 1, just to kind of give an overall summary, my personal experience, an example with a massive change was that Mayo just celebrated our 1-year anniversary of magnet status at Florida campus. So I'm going to kind of go through and, say Mayo was the change agency. Our change agent for Going Magnet was our chief nursing officer at the time, Deb Harrison, with the assistance of our magnet program coordinator, Jennifer Lofgren. These 2 women, it had been their goal, given the local competition, that we should go magnet, as Rochester was also magnet, and I believe Arizona was too. Our opinion leaders were not only nursing leadership and administration, but also some professionals outside in ancillary positions and respiratory, some individuals in the clinic administration, as well as medical administration. Champions and opinion leader, well, they were the opinion leaders. So you had your change agent, your opinion leader. Our champions were identified for each unit. I myself was a magnet champion, which added kind of another layer of opinion leaders, or you could call us change aides if you want, as we more closely identified with nursing staff versus nursing administrators, as we ourselves were staff nurses. When deciding to pursue magnet, you can educate opinion leaders and opinion leaders and change aides to help your diffusion of an innovation across the system. So, as I previously said, Mayo was a centralized system from top down, from nursing administration to staff nurses. And we received magnet education. Many of the opinion leaders, champions, and change aides went to magnet conferences, received magnet education to help us better diffuse the innovation across the system. And lastly, I would say most of our opinion leaders were monomorphic. They were geared toward promoting magnet status. However, I have also seen them function in a polymorphic role as well. They seem to be opinion leaders for numerous things. So hard to say, but I would say overall monomorphic. So anyway, I hope this helps. And that concludes my blog for chapters 8 and 9, Diffusion of Innovations.